So in this video, we'll go through what is differential diagnosis based approach in FCPS or MRCPCH short cases. So the most common reason the candidate failing, they are poor in time management approach. They don't have any approach, especially differential diagnosis based, poor method performance. So first two things, poor time management and approach, you can improve by practice. And the third one, you have to perform these cases, practice in front of the person who has already passed FCPS, and they can check your methods. So any case, in any short case, you approach with the introduction and consent, and then initial 20 to 30 second, you approach patient with the LADS give mnemonic. So that's the initial screening method, which will give you the insight about the patient. Listen command carefully, and you LADS give has been explained in the last video. So LADS give you the overall impression of the patient, and then before you jump to the patient, you should have some differential diagnosis, so that keeping those differential diagnoses in your mind, you can examine the patient. So I will explain how it will work practically. Suppose you have seen a patient like a 6-year-old patient who on initial LADS give approach, sick looking with the cyanosis and clubbing on gross physical examination. So in this patient, you make 3 differential diagnoses. The most common differential diagnosis in these kind of patient is tetralogy of fellow, but you also keep in your mind 2 other differential diagnoses like TGA with VSD, unrepaired obviously, or patient may have TAPVR, especially like supracardiac or cardiac TAPVR. So these are the 2 other differential diagnoses other than the top. So on physical exam, how you will go, you will elicit signs. If your physical command is general physical for that patient, first you do your general physical command and then you do relevant. But mostly in these cases, your command can be examine a child who has a cyanosis or examine the precordium. So in these cases, first you will do cardiovascular or precordial exam depending on your command, and then you will do relevant exam. So keeping in your mind these 3 differential diagnoses, what we have made in this case, who is showing you the cyanosis and clubbing, tetralogy of fellow, TGA with VSD or TAPVR, what you can do, because remember TOF, they normally don't have signs of failure, but in case of TGA VSD, you may have hyperdynamicity of precordium, and obviously these patients they are very much failure to thrive, and they have signs of failure like TGA with VSD, or the patient who has supracardiac or cardiac TAPVR, they will show you signs like VSD, hyperdynamicity of precordium, and liver may be down and severe failure to thrive. So this is how, but these signs you will not get in TOF. TOF, you will get right ventricular heave and apex beat will be normal, thrill maybe, and you will get murmur, and obviously you will supplement, because you will keep the TOF on the top, because TOF is the most likely diagnosis in these kind of patients. So the rest physical sign, like if someone is edematous, you keep, before you jump to the patient, you keep in your mind differential diagnosis. Okay, this patient, if the patient has a edema, most likely is a renal, can be cardiac, but most likely renal or liver disease. If patient has a small head, then you keep in your mind that maybe it's a like familial torch infection, or maybe patient has some post meningitic sequelae. So immediately in the LADS give approach, you make in your mind differential diagnosis, and then you approach patient to elicit positive finding for the first diagnosis what you are trying to make in that patient, and the second and third you will see the negative findings. You will elicit that these patient does not have these signs which negate against which supports that second and third is not your diagnosis. The first one is the diagnosis, and you supplement your diagnosis with a positive finding. Suppose if you get a large head. So in case of large head, immediately in a let's give approach, you will be looking for differential diagnosis like maybe hydrocephalus, or a patient has a familial large head, or post meningitic hydrocephalus. So in these cases, or it may be like storage problem, or a severe vitamin D deficiency. So what I am trying to say here, that make your differential diagnosis before you jump to the patient in a let's give approach, initial 20 to 30 seconds in a short case, and that will give you more margin of passing that short case. So if patient has a malnutrition with clubbing, think about like cystic fibrosis is the most likely diagnosis, and then you make second and third diagnosis. Most likely this patient is suffering with the bronchiectasis or chronic lung insufficiency. It may be primary ciliary dyskinesia, Cartagena syndrome, but keep cystic fibrosis on the top. In a patient who has malnutrition with clubbing and tachypnea. Same patient, another patient who have jaundice with clubbing, chronic liver disease, or maybe that patient, faces tell you this patient has a hemolytic anemia, thalassemia with chronic liver disease or some kind of storage problem. So before you finish your short case, you need to know your differential diagnosis, and in all short cases or even long cases, consider examining about the growth if it is relevant. Nutrition you can comment, development also you have to comment. So these are the important things which you need to have idea, because mostly chronic ailments, they disturb the growth and nutrition of the patient, and they may even impair the normal developmental milestones. So time management is crucial. As I have told, listen command very carefully, and whatever they have given you command, first finish the basic command and then relevant. And obviously at the end you will come up with differential diagnosis, investigation plan with the management approach.